I had no idea what female pelvic disorder is.
I was feeling scared because I knew something was wrong. I just didn't know what was wrong, and no one seemed to be able to tell me.
I had a difficult time finding a physician who deals with this.
These women aren't alone. An estimated 1/3 of all U.S. women will be affected by a pelvic floor disorder, according to the National Institute of Child Health and Human Development. And the number of women affected by female pelvic issues is growing. Female pelvic floor disorders represent a spectrum of conditions that millions of women in the United States suffer from. Although the fastest growing population in the United States are women over the age of 65, we're seeing more and more younger women present for evaluation and treatment of these embarrassing conditions.
I was pregnant with my second child and felt like my insides were falling out.
Symptoms were pain and infection, swelling with infection.
Women can experience a variety of symptoms. Some of the symptoms that women share with us include pressure and bulging of the vagina, urinary leakage, trouble emptying their bladder and having bowel movements, as well as frequent trips to the bathroom.
My diagnosis at age 26, which stayed, of course, is called rectocele and cystocele. And in essence, what they're talking about is everything inside is no longer supported and falls. And you really need surgery to correct that.
There are several common pelvic conditions that women experience. For example, incontinence of either bowel or urine, pelvic organ prolapse, emptying disorders, or overactive bladder. These symptoms can occur alone or in combination.
Even playing and getting up and down with grandchildren or sitting for long periods of time reading to the grandchildren, if the infection was, if it was infected at the time, because I had said before it was on again, off again, it's painful. So it just affects everything you do on a daily basis.
Everyone in my family, including my spouse, everyone is very physically active. They love to hike and bike and swim and run and do all these things, and it's difficult if you have a rectocele and cystocele to be as physically active as you'd want to be.
I didn't want to be around people because of the problems I was having with leakage, and I was having problems with irregularity and gas and things like that. So it was really embarrassing to be around people. Also, it affected my intimate relationship with my husband because I knew something was wrong and I didn't know what it was.
Emotionally, it kind of wears you down. Just having a on and off again infection or some kind of drainage that never goes away is kind of wearing on you. So I think after a while it just gets on your nerves. You just want to go back to not having the condition.
It affected me by making me depressed. I felt like I've lost quality of life that I was used to. I'm not a person that gets sick a lot, and so I didn't know how to deal with it.
It's important to remember that it's never too early nor too late to seek treatment for pelvic floor disorders. These conditions are common, but not a normal part of aging. They occur across the life spectrum.
Nobody wants to think that they're going back in diapers. And if there is some mechanism by which you can have your body in control, you know you're going to try it. Certainly we talk about problems with our spouse or our children, and it's a shame that we can't help each other and talk more openly about this.
I think the first and foremost thing is to have a woman realize she's not alone. I'm amazed at how many patients come to see us who have been referred in by either a family member or a friend with very similar problems. The second issue, I would say, has to do with self-advocacy. a patient needs to bring up these conditions and symptoms with their healthcare provider.
I would encourage someone to be their own advocate. No one's going to do it for you. Make sure you talk with your doctor. If your doctor doesn't give you satisfaction in helping you to identify what is wrong, and then request to be referred to a specialist.
If you feel any of these symptoms, by all means, I would certainly encourage you to talk to your gynecologist. It will make a difference in your life.
Despite how common these conditions are, many women hesitate to seek evaluation and treatment due to the sensitive, private, and embarrassing nature of these conditions.
There are several treatment options for pelvic conditions. These include non-surgical and surgical. Non-surgical can include things as simple as making dietary changes, exercise, and pessaries. Surgery can be tailored to the patient's needs and goals.
I was most pleasantly surprised to find that not only could I have surgery to correct this, but it is very easy and very minimal.
My recovery was really uneventful. It went smoothly. I healed great, and in 2 weeks I was ready to go back to work.
The activities I was able to resume were I work out now. I have friends and family over for dinner. I go out with my husband, and I'm able to be intimate with my husband again.
Oh, to get back on the four-wheeler and be able to ride that with my husband was a joy, because we have a farm and we use the four-wheeler usually on a daily basis. So that was good. And the first time that I got on it, that after I knew that with the recovery and I had the surgery, and I realized there was no pain, it was great. After having the surgery, I really felt like I got my life back.
I now have freedom and confidence. I can do things now like taking long walks and going boating and doing gardening and the things that I love to do in what I call the golden years. And my only regret is that I didn't do this surgery sooner.